Meanwhile, South Africa continues to record numbers of COVID-19 infections as the third wave rises ever higher. Last night, there were more than 24,000 new cases. Again, Gauteng accounting for the vast majority of those at 58%. South Africa has breached the 2 million mark in terms of overall cases. Earlier, the death toll crossed 60,000. To discuss, we're joined by Professor Shabir Madhi, who is the Dean of the Faculty of Health Sciences at Wits University. Professor, thank you for being with us. Firstly, your thoughts on Sinovac, that vaccine being given conditional approval?
So I think any COVID vaccine that has a potential to be able to protect life and to reduce severe disease is most welcome. But I think calling this a turning point in our COVID-19 vaccine rollout program is a bit of an over-exaggeration. The Sinovac very likely will protect against severe disease, but extremely unlikely that it's going to have anywhere close to the type of effectiveness as the Pfizer vaccine against mild disease due to the Delta variant. Against the original virus that was circulating, as an example, the Sinovac vaccine only had about 50 to 60% efficacy, compared to over 90% efficacy for AstraZeneca, for the Pfizer vaccine, and more than 75 to 80% efficacy for AstraZeneca vaccine. So we would expect it to work against severe disease, as with most COVID vaccines, but certainly when it comes to preventing resurgences such as the one that we're experiencing, probably not going to have too much of an impact, as has been evident in the experience in Chile. Where they mainly use the Sinovac vaccine, but we're still experiencing resurgences, although the number of people that end up dying is much less.
I was going to ask you about that because there is increasing reporting on the concerns that the antibodies you get with the Sinovac vaccine aren't as strong. So you say the efficacy just isn't there. So as a country, you still believe we should be focusing on the vaccines, procuring more of what we have, Johnson & Johnson, Pfizer, maybe adding AstraZeneca to that?
No, I think the Sinovac vaccine is fine to also procure it, but our expectations need to be sober about what we can expect of those vaccines, as well as some of the other vaccines. So the Sinovac vaccine, like I said, is going to probably protect against severe disease, because that's what it seems to be able to do in Chile as well. Not 100% protection, obviously, but then even the Johnson & Johnson vaccine probably has about 80% or 90% protection against severe disease. But it's not going to protect against milder disease. And if it's only authorized for use, as an example, in people between 18 to 59 years of age, unless people have got underlying medical conditions, they're not going to benefit much from the vaccine, because even when they are infected, the reality is that they usually end up developing mild disease, which this vaccine, unfortunately, is going to come short in terms of protection from the Delta variant.
All right, let's look at where we are as a country. We'll see if that gets full approval, if we start procuring Sinovac. But in the meantime, we're battling this third wave. Knowing Delta now is driving this, you're watching the trends. Are you able to predict, is anybody able to predict when this will all peak, when the third wave will peak and start to come down in terms of infections? Or is the sky still the limit?
No, I don't think the sky is the limit, because eventually what happens is that when a certain percentage of the population does become infected, together with the use of social distancing as well as avoiding mass gatherings, that actually takes the wave down. And that's the reason why the two previous waves started to wane. It's not that we had vaccines that allowed those waves to wane. So it really depends what percentage of the population needs to be infected before that happens. And it's going to differ across the country. So as an example, in Gauteng, in all likelihood, there's some data which suggests that we might well be peaking, but certainly for provinces such as the Western Cape, Eastern Cape, KwaZulu-Natal, they probably are about 4 weeks behind Gauteng with regard to this current wave. The level 4 restrictions will probably benefit those provinces more than Gauteng, but at the same time, those provinces will likely have a slow burn, meaning they'll have a much more extended outbreak than what actually is being experienced in Gauteng, which itself is bad.
It is bad, and look, the vaccines aren't coming in thick and fast, although the number per day is picking up. We're slowly heading towards 200,000, which I think was the prediction per day if we had to start at the beginning of the year to reach herd immunity by the end of the year. It's now the middle of the year, so we're not going to get there. At this rate, could we reach herd immunity in terms of the Delta variant because of infections rather than vaccines?
No, so we're never ever going to get reach herd immunity. I think the whole notion that South Africa would reach herd immunity, even if we vaccinate 40 million people, is completely misfounded. We're not going to reach herd immunity. But what we need to be able to do is get enough immunity in high-risk individuals that we don't end up with our hospitals being overwhelmed and that we have the minimal number of people dying of COVID-19, which is very different. We can get back to a relatively normal lifestyle, even if we were only to vaccinate about 15 to 17 million people above the age of 60 and those with underlying medical conditions, because that would significantly impact on the number of people that end up in hospital. It's no longer about trying to get rid of this virus. That was never going to happen, and especially not since November of last year when the Beta variant evolved. So it's really about being focused about what our goal is, and our goal shouldn't be even thinking about herd immunity, because if that is our goal, we will fail.
Yeah. All right. So you're saying focus on the hospitals being overloaded, and we know that there's a very worrying situation in Gauteng. Then the reports are that 10,000 teachers or so did not want to be vaccinated. Are you disappointed?
Absolutely, especially since the teachers' union was screaming from the top of the mountain about the need to protect its members. And here we find that many of its members are now reluctant to be vaccinated, which is really, really extremely disappointing, not just especially for the students whose education has been compromised over the past 15 months or so. So I think what the unions need to do is they need to make a firm stand with the members and encourage them to come forward to be vaccinated, because this serves no one's purpose. Firstly, it's actually unfortunate that teachers are being prioritized when, as an example, people in the service industry who are at much higher risk than teachers of being infected with the virus are not being offered the vaccine. Yet we find people that are being offered the vaccine now essentially kicking the horse in the mouth, which is completely unacceptable.
Yeah, and not all teachers, many welcomed it, but disappointing. You say reports about those 10,000. Also bad news that you told the Moseneke inquiry that elections are out of the question in October because we might be in a fourth wave. I certainly don't want to hear that. Nobody does. Why do you believe that, Professor?
Well, I think it goes back to the issue that for this particular wave to subside, you require a certain percentage of the population to be infected, coupled with people adhering to some non-pharmacological interventions, and especially not attending mass gatherings and wearing a face mask. Those are probably the two most important interventions. What the level 4 restriction is essentially going to do in many places at an early stage of the resurgence is that it's going to draw out this particular resurgence. And as we go to lower levels of restriction, in all likelihood, we're going to see flare-ups take place in those provinces. So initially, we were estimating that we would likely get another wave in December or so, which probably is not avoidable. But with these restrictions, it sort of changes the pattern of the circulation of the virus when people get infected. So we probably will experience a resurgence sooner than later once we start easing on the levels of restriction.
All right, so let's not cling to returning back to normal or pre-COVID conditions anytime soon. Thank you very much for that update, though. That was Professor Shabir Madhi, who is the Dean of the Faculty of Health Sciences at Wits University.